This is the Managed Care Stakeholders Summit, a gathering of those who play a part in making health insurance possible amidst the obvious challenge in the country's healthcare system. All these against the backdrop of what Nigerians have tagged a flawed health insurance system. Minister of State for Health, Adeleke Mamora, in his speech at the event acknowledged the complaints of Nigerians but noted efforts to make things right.
There have been calls for the review of the NHIS Act to make it mandatory the enrollment of all adult Nigerians under the NHIS, of course with their dependents. Obviously, an occasion like this will necessarily, in one way or the other, feed constructively into the narrative, thus helping to galvanize and build the requisite momentum that will ultimately result in arriving at that desired destination.
Some of the stakeholders answered the question of whether the NHIS is a scam, as many Nigerians have alleged.
NHIS is not a scam at all. You can't be operating a scam like the addresses that have been read today. You are aware that we have about 30,000 enrollees for years now, 2014 thereabout when we started to date. So it can be a scam.
Others, including the Executive Secretary, Petroleum Equalization Fund, Ahmed Boboy, noted some of the areas the NHIS has not delivered and must now be corrected for the scheme to work.
Reconciliation of medical bills and the attitude of the staff towards their patients, because it is very important. Because if the relationship between patient and medical personnel is not harmonious, is not encouraging, obviously the patient will not be happy to patronize such facilities. So, but if there is courtesy, there is understanding, there is there is empathy in relationship between patient and medical personnel, obviously things will improve.
As at the moment, the coverage of NHIS is quite limited, and only people in formal sector that benefit. Even though there are some group social health insurance that are coming in, but the numbers are not quite encouraging. So we need to have a better platform within which to bring on board all Nigerians. So we are advocates of that.
The tariff that the government has put for services, to the generality of the public, the tariff for treatment is very, very small. It's minuscule, compared to today's in today's economy. That's very, very small. I mean, you cannot, put such figures as less than 700 naira to treat somebody with malaria.
Godfrey Eshamoge, Galaxy News, Abuja.